Certainly, I'm grateful for the care that my son David received while he was just an infant. David was born with a diaphragmatic hernia, but because of the professional care of the medical team at CHKD, David was able to receive the treatment that he needed to actually survive. And we were just thrilled and grateful for the care.
For more than 60 years, CHKD has been bringing health, healing, and hope to families across Southeast Virginia, Virginia's Eastern Shore, and northeastern North Carolina. But the story starts much earlier, in 1896, when a visionary group of women, known as the King's Daughters, united to care for the poor. They started a visiting nurse service with a bicycle for transportation, setting in motion a force that would change the history of their community. Over the years, they opened clinics and added services, eventually making it their mission to open a hospital just for children.
The early King's Daughters raised over $1 million to open CHKD in 1961.
That was a ton of money back then. I'm sure they would be amazed to see the results of their efforts today.
Today, CHKD is an independent healthcare system with more than 4,000 professionals dedicated exclusively to the care of children in more than 40 locations. The CHKD Health System includes a 206-bed hospital, a regional network of pediatric practices, surgical and medical specialists, and community health centers to bring key pediatric services close to home. In 2022, CHKD opened the 60-bed Children's Pavilion to address the mental health crisis facing our youth.
The needs of children are constantly changing. Our promise to the community is that we will always be responsive, resilient, innovative, and forward-thinking. Through the vision of the King's Daughters and our mission as a nonprofit hospital, no child who needs health care will ever be turned away from CHKD.
Philanthropy is critical to our work, absolutely critical. And engagement from every sector of our community has always been essential to what we do. It has defined our past and our present, and it will define the future of CHKD.
Community engagement and support were powerful catalysts for the Children's Pavilion.
CHKD had the vision to expand its mission at a tremendous financial cost, because that's what kids in Hampton Roads needed. The mental health crisis hit them like a tidal wave, inundating their pediatric practices and emergency department. They had to act, and they did.
The success of the Children's Pavilion campaign reflects the compassion and the generosity of our community.
We are so incredibly grateful for the support we received. The community, governmental agencies, foundations, corporations, individuals contributed more than $85 million toward the $224 million Children's Pavilion. That support empowered us to build a beautiful Children's Pavilion, and even more importantly, to hire brilliant talent to develop a comprehensive mental health program for our children.
It was the biggest response I've ever seen in all my years of fundraising, and it's all because of what CHKD means to this community.
Because of CHKD, children can stay right here in Hampton Roads for care, even for life-threatening illnesses and injuries. CHKD has the area's only Level 1 pediatric trauma center, its only pediatric emergency department, a pediatric intensive care unit, and a neonatal intensive care unit, providing the highest level of care for the region's tiniest patients. As a teaching hospital and home to the Department of Pediatrics at EVMS, CHKD is instrumental in the building of our regional pediatric workforce.
The CHKD EVMS residency program is where we train the next generation of pediatricians. Many of them stay right here to practice, or return here to practice as surgeons or specialists after additional training.
CHKD also brings innovation to our region. In the late 1980s, CHKD surgeon Donald Nuss invented a procedure that is now the standard of care to correct a common malformation of the chest. Surgeons have come from all over the world to study the Nuss procedure at CHKD.
It established us as a national and internationally recognized center for the study, training, and treatment of chest wall conditions. This year, we will complete our 3,000th chest wall surgery, more than any hospital in the United States.
For babies born with heart defects, CHKD and the University of Virginia established the Virginia Cardiac Collaborative in 2017. We share surgeons, education, and training to give kids throughout Virginia the best possible care close to home. But the innovation at CHKD doesn't stop there. Dr. Crystal Proud was one of 4 doctors in the country chosen to conduct clinical trials for a new gene therapy for Duchenne muscular dystrophy, which usually causes death by age 30. Now approved by the FDA, the therapy offers the first real hope to families living with Duchenne across the globe and in our backyard.
Every year in our community, 50 to 75 children are diagnosed with cancer. What most people don't know is that they can stay right here at home and receive the care they need, including access to the latest clinical trials. At CHKD, we're constantly learning and evolving the care we deliver as science and technology advance our ability to heal.
The great thing about CHKD is that we deliver the treatment children need while honoring the kid in every child. We make sure they can play, have fun, and keep up with their schoolwork. We celebrate birthdays and holidays. We even have proms and graduations. Sometimes what we do can be scary and serious. We want to make sure children get to be kids as much as possible.
We treat your children like we treat our own, because we're all moms and dads, aunts and uncles, and grandparents too. We know medical care can be scary for kids and parents, so we work to make it less so. We worry about whether our patients have food on the table at home and whether they're keeping up with their schoolwork. And we know that teddy bear is going with them to the OR no matter what. They're kids, whether they're 7 days, 7 months, 7 years, or 17 years old. That's all we care about. Kids.
We believe in the sanctity of the trust parents have in us when they place their child into our waiting arms. They've heard our promise of health, healing, and hope for all children, and for each and every one of them, we must deliver on that promise.